Eyewitness News special presentation, Coronavirus in Connecticut.
Good evening, everyone, and thanks for joining us. I'm Dennis House. Welcome to this 3-hour primetime special, an unprecedented local television event in an unprecedented time in our history.
And hi, everyone. I'm Erin Connolly. Our goal in doing this tonight is to get you answers to the questions you have about the coronavirus here in Connecticut. These are scary, unsettling times, and we are in this together.
That is for sure. Hi, everybody. I'm Mark Zinni. From the governor to our U.S. senators to doctors and nurses and the state's leaders in education and much, much more, we have brought together a team of experts who are here tonight for you. I will be back in the 10 o'clock hour. Aaron will be here with more coming up at 9, but Dennis House is going to start things off. He is standing by right now with Governor Ned Lamont. Dennis.
All right, Mark, thank you very much, and thank you, Governor Lamont, for being with us. I know that's been the busiest time in your career as governor, and we appreciate you spending your time with us tonight. And I want to ask you, because we're all going through anxiety during this very stressful time, and I wanted to ask you how you're coping, because yesterday you had to announce the first coronavirus death, and you were clearly upset by it.
Yeah, the coronavirus was something over there in Wuhan, China. Then I saw these pictures from Italy and then Seattle, Washington. It was getting closer, but it was not something you saw. A lot of folks weren't really taking it that seriously. And then you have a death. And we've now had 3 fatalities. One old guy was a great friend of my dad's, so it really comes home. And I feel, responsible for this state. And I think of us like a family, and it was like losing a member of the family.
I didn't realize he was a family friend. Did you have to talk with his survivors at all about this and explain to them what's going on?
I did, yeah.
Let's talk a little bit about, there was some breaking news today. As you mentioned, there was a 3rd coronavirus death, 169 cases so far in our state. That's almost double from what we reported yesterday. I believe it was 91. Do you see this exponential growth every day?
I'm afraid I do. I mean, we're not totally taken by surprise. I mean, we can look at what countries that have handled this well, say Hong Kong and Singapore, and you can see countries that have handled it badly, like Italy, and you've seen what that exponential growth has been. We've almost doubled the number of folks infected every couple of days, and that's probably not the right metric, because the number of people infected is many-fold more than the number of people we've tested and can show are infected.
We had 4 police officers, Hartford police officers, who have now tested positive for COVID-19. Also a state lawmaker tested positive for it as well. Do you believe that the Capitol is shut down right now, and the LOB, will that continue for some time?
I believe it'll continue for some time. They're going to be careful. I've got to pass an emergency bill. We've got to get our budget done. The legislative leadership on both sides of the aisle have been very thoughtful about this, and my hunch is they'll come in very small groups to cast a vote and move on. I think people are being careful, and I want our leaders to be careful by example, because if you're casual, as they were in Italy, you saw a contagion that got prolonged unnecessarily.
When you ran for governor, this was obviously not part of the plan. No one could have predicted this was going to happen. And as you've gone through this process, what have you learned about the state's preparedness for something like this, and what are we deficient in?
Oh, democracy is a little slow to react, and they were very slow in Washington, D.C. I'd like to think we were a little bit ahead of the curve here in Connecticut, but just a little bit ahead of the curve. And this is a wave that's crashing. But when we mobilize, it's like a war, we're mobilized. I spent an hour today with the hospitals, and they are gearing up. I hope it's not a surge. I hope we can flatten the curve, as they say, and make it possible for us to stretch this out a little bit. We talked to all the small businesses today, I should say 3,000 of them, by telephone. We're being very careful and doing everything we can to give those folks confidence. We're going to help them power through, give them some of the, low interest loan support they need to get through this problem.
What do you say to the viewers at home? Because this is a very anxious time for families, and they're wondering, am I going to get it? Is someone in my family going to get it? And will I be taken care of when that happens? Is the state prepared to take care of thousands of sick people?
Well, first of all, stay home. If you got a grandfather, make sure he stays home. If you want to go see him, don't go see him. Talk to him by FaceTime. And for you moms and dads and your kids, I know the kids are driving you crazy. Keep them at home. That is by far the best thing you can do over at least the next few weeks, and see if this crests over the next 3, 5, 8 weeks.
We have some other questions I want to ask you in a moment, but first let's get some viewer questions that we've been getting in all day. And this one here says, I have been following the governor saying he's calling on retired RNs to come back to work during this pandemic. Although I am not retired, I am an RN and would like to offer my assistance wherever I can on my off time. I'm sure many of us would. However, I can't find anywhere to do that. Reaching out because you interview him frequently and maybe you know, or perhaps you can ask him. So I'll ask you right now, Governor, how do people, if they want to volunteer, what do they do?
I think it's CT Nurses or CT.gov. We've had over 500 retired nurses. We've reached out and they've said, what can I do to help? We're going to some of the nursing schools so we can have apprentice nurses, get them back in. We're relaxing certifications so nurses from around the region, as needed, they can come in and help us. Look, we're going to have some shortages depending on where this virus takes us. We got to be prepared.
Here's another viewer question for you. Sarah P. writes, if this is best mitigated by social distancing, why don't governors or the federal government mandate a quarantine?
I think people are doing the right thing without having to have a heavy-handed mandate. You know, I didn't tell everybody don't have a St. Patrick's Day parade, but I said you really shouldn't because it could be dangerous to your community. And all the mayors and first selectmen stood up. I said, look, I was very early in this when it came to closing down our schools. We got a lot of back and forth about that, but 95% of our schools did that. I worked with Cuomo and Murphy and our other regional governors when it came to closing down our restaurants and bars. I'm afraid I had to do that. Those bars were crowded on Sunday, and we had to close them down. And anything I can do to convince people voluntarily stay close to home, lower those social interactions, don't get into groups, we'll get through this.
Do you think some people just don't get it? They just don't understand how bad it could be?
Yeah, we were both 19 at one point. We thought we were invincible. We thought everybody was sort of making it up. And I hope that they've seen by examples elsewhere that they are endangering not just their lives, but the lives of folks around them in the community. I know how hard it is, especially at a certain age, but you really got to convince people this is the right thing to do.
I know your office has been talking with hospitals and the CEOs of these healthcare systems. Are they prepared in terms of equipment? We hear stories out of Italy that perhaps they don't have enough ventilators and that a choice has to be made. Do you give it to the 40-year-old father of 2, or do you give it to the 85-year-old who only has a few years of life left anyway?
Well, first of all, no. Nobody's ready for ventilators or swabs or PPE, the protective equipment you need.
We're not prepared.
I don't know what happened. We should have been on this 4 or 6 months ago. A pox on our houses, so to speak. But be that as it may, we are gearing up. The president, a little slow off the draw on this today. He was on the conference call with all the governors. He is all in. They are putting in place orders to those that manufacture, say, the ventilators. An ounce of prevention is obviously so much better. If we had had this a month ago, so much the better. Right now, in terms of swabs, we need those desperately so more and more people can get tested. We're testing 100 times more than we were just 10 days ago. We got to do better.
Who's to blame for that 4 to 6 months ago for not ordering this equipment, not ordering these supplies?
I'm not into the blame game. We have CDC. You would have thought they would have been pushing harder and saying this is the type of thing that can happen. We saw what was going on in China. That was back in December. You thought there might have been more national leadership here. But look, I had a hard time, working with folks when we wanted to shut down, the high school basketball championships. We had tens of thousands of people signing a petition saying don't do it. We had kids protesting out there. But we've got to take the lead. I think our leaders are doing that now. I can tell you the hospitals are stepping up in a big way. Even the federal government's stepping up right now.
The director of CIAC is looking pretty bright now. He was one of the first to call for that cancellation. More with Governor Lamont in just a moment. We're going to take a brief time out. We'll continue our conversation and questions from you on the other side of the break.